Thank you guys for joining us. My name's Kieren. I am the Senior Digital Capability Officer. Today's session is just a little bit different. I ordinarily have a presenter join us. I'll be doing this session myself today, just because I do happen to know the content reasonably well, and we will be covering my health record as it pertains specifically to residential aged care homes. So the Digital Health Agency has put through another bit of a push on this one here. They're offering a bit of assistance in getting registered, and they do have a few new features that have been added to my health record. So it just makes it topical to make sure we cover it now. So before we really dive into it, I'll just give an acknowledgement of our country here, and just acknowledge the traditional owners and custodians of the land that I'm presenting from. That's the Bindal and Wulgurukaba people in Townsville. And just to acknowledge those are the respective lands of everyone in today's call. I acknowledge their continuing connection to land, sea and community, and pay my respects to elders past, present and emerging. For those of you who are participating for the first time, I'll just also put out a welcome to the Digital Champions Network online workshops. And through these, we hope to deliver helpful tutorials, educational sessions, then virtual services, which will be accessible via telehealth carts, and to provide a platform for peer discussion of all aspects of digital health as it applies to residential aged care. Look, I'll be giving a presentation today, but since it's a community, I really don't mind. It's a pretty small call today and everything. If you guys have any questions or anything, feel free to raise your hand or simply interrupt if you've got questions about how my health record pertains to your home. Happy to stop there and maybe just try and cover a little bit. Otherwise, yeah, if you've got something that's a bit of a deeper dive, save it for the end. Or also, I'm very accessible to all you guys individually at a session. So feel free to take advantage of me as a resource. So as I said, talking about my health record, covering some basics in the first little bit here. My health record, just to define it, basically it's Australia's national electronic health record. It's a centralised repository, and it's personally controlled by the actual individual. Okay, so the person who is the patient gets to decide what goes in there, or more importantly, they get to decide what doesn't go in there. It's a very opt-out system to try and basically catch a large proportion of Australia's population who really don't care too much either way. It's the health professionals who are highly invested, and then basically a small minority who don't wish to have one because of various reasons. So of course, yeah, basically that means that it's centralised, it's national, it's accessible at all times, and it is very vigilantly protected by the Digital Health Agency's cybersecurity branch. My health record contains documents that come from all sources. So you've got a lot that the health providers are updating themselves. Okay, you've got GPs, pharmacies, pathologies, imaging specialists, hospitals, whatever, all contributing their various pieces of a health record directly. You can have, though, the patient, the consumer, the resident, whoever it be, uploading a few details themselves, okay? And that might be just nominating their emergency contacts, putting in their advanced care planning, their wishes and such, a bit of record from their childhood maybe. You got some things streaming from other services too, from Medicare, the immunisation record, and lately we've got My Aged Care also putting things in there in terms of support plans and assessments and everything. So the benefit of this is really that you get a very clear picture very promptly of summary health information to do with a person from all their sources of information. So if you have someone come up to your doorstep, you know, and you transfer into your care in residential aged care, you can see what's gone on in their hospital events immediately preceding their admission, during their community care, from their GP, from their local pharmacy, etc. You've got a good idea, and it helps you get an idea of what's going on with them as a person, you know, their allergies and their needs and such. You don't have to spend time chasing this in the initial stage just to get your entrance stuff all done. Really quite important in that after hours, especially if someone turns up on somewhat short notice. And so how do you get into it? Look, there's a few ways. It really depends yourselves as a health provider. A lot of people get quite fixated on whether or not their software is going to work with my health record. Odds are actually pretty high that it's going to work. A lot more of your pieces are becoming conformant with My Health Record each month, and it should be by mid-year. There's actually quite a lot of the providers who have a bit of a deadline on actually coming on board or not. And it may not even just be your patient or your clinical information systems. It might be your medication management system too. So you may not find that your primary clinical software is compatible, but it may be that if you've got a product like BestMed or something, that is going to be compatible to view, say, medication elements of My Health Record. But if your software is not conformant, that doesn't really matter. You can use a web view and you can actually just view it online, assuming your organization has all the appropriate registrations. You can use a web view to check it out, National Provider Portal. That is just a read-only view, but it's not too critical because in aged care, you're not directly uploading a lot of documents. You are doing a lot of reading of documents to find information. If you're a consumer, and of course, many of you guys also are, you've got a split personality, you've got a professional life, and you've got your own My Health Record probably too. You can simply check your My Health Record through your MyGov, manage it online on the computer, check out your permissions, your security features, and which documents are being uploaded. Or more conveniently, you've got your My Health app too. And My Health app just brings your My Health Record to your phone and basically gives you that, again, you get those a lot of those same management features in the palm of your hand. But as a pharmacist, I really like that it really brings together the Digital Health Agency's sort of other initiative, which is all the new electronic prescribing stuff. So if you've ever actually got one of those, you get all these little QR code tokens that are now your prescriptions, and they get managed in individual SMS text messaging threads. It's really annoying. The My Health app will actually consolidate and manage those tokens for you, and you can access what they call your active script list if you've signed on to that, and check out all your remaining repeats and everything too. So it becomes a really centralized prescription management platform as well. Again, as we were discussing before we sort of come in, it's really nice when things start integrating, putting all those things in one place. So we're really getting there with that. The My Health app might be something in aged care where it might be really convenient. It may be a family member or something who's invested in their, the residents' healthcare. This may be a really convenient way for them to sort of check up on the progress and say if blood results have come in and the doctor may have visibility of them, or that sort of thing, or just following medication changes. So My Health Record, a lot of people, and very rightly so, get quite concerned first thought about, oh, the government has all my information, all my health stuff, how's it being used, is it secure, who can get at it? It's really highly regulated. We've just got here the primary bits of acts and legislation that actually govern the information that goes into My Health Record, and it starts with very generic things like the Privacy Act and basically things that govern health information generally stored within Australia, moving towards specific rulings that have surrounded the use of My Health Record that provide appropriate exemptions and pathways for this to be checked in its own special ways, in its own special scenarios where you may have pre-authorization through your proto registration to actually go and look at this without seeking consent every single time you check a record. And so all those bits of legislation really sort of come to allowing, as foremost part of the record, the consumer, the resident, the agent, whoever, in managing the privacy and control. As I've said, you can opt out at any stage of having a document, having a My Health Record entirely, but it can be more nuanced than that. You can actually control specific documents within your My Health Record. Okay, you can choose to say, I don't want that document uploaded. You can choose to password protect individual documents so they can only be accessed by your doctor who asks for the password and explains why they need to see that document. You can do that password on your entire record so that someone really just has to ask before they go in. Or you can simply go, look, I don't care in every case where, I don't want to be giving my password out every single time, but I want to know who's going in. And you can choose to get an SMS or email that basically just notifies you who's checking. And you can go, cool, that's my pharmacy. I know they're going to be checking. That's great. I understand that. However, you might find that, that's just in place where it can give a notification where some unrelated health providers checking out or snooping things. So they might then in that situation go, right, I'll go and set passwords on things. I'm glad this is alerting me. There are a lot of safeguards, and I should say irresponsible use. That snooping is quite heavily penalised. I'll skip ahead on that. There is some slides later on that, but basically just to come back and say, look, the safeguards in place to stop the irresponsible use and the access outside of people who aren't authorised to use it. So you've got your typical sort of cybersecurity steps, encryption, firewalls, you've got your login processes, and you've got audit logging. Basically, there's an entire team at the Digital Health Agency dedicated to just reading really boring access logs, who go through and just make sure it all seems kosher. It seems like they're all health professionals. They're all coming from within Australia. We're starting to see terabytes of data being accessed from Russia and China. They're actually on those, noticing that sort of is being accessed, and like, right, we should probably do something about stopping that. So you've got a very vigilant team dedicated to just that single aspect. And the reason why so many software packages are not yet conformant is mostly because there's a very intensive vetting process that allows a piece of software to access and upload to My Health Record. So everything, Lead Care, Autumn Care, whatever piece of clinical software your home may use, if it's conformant with My Health Record, it's gone through a vetting process and probably had to up its security standards before it was allowed to engage with My Health Record. So you've got different permissions that go through your registration that get applied to you as a professional, you sort of for your organization, and then yourself as an individual get vetted to make sure that you as well can access My Health Record. So you get an authority to view, and basically you are authorized by law once you've gone through that vetting to access My Health Record without seeking permission on a opt-out kind of basis. Okay, again, they would, as a resident, as a patient, as a consumer, they would have to say, no, I don't want you in there, rather than allow you access every single time. So they have to manually, or their agent would have to manually set up a password or a protection step. Otherwise, you will have default access because you will have gone through some vetting. Same thing on the grounds of uploading as well, with the additional step, that basically you cannot upload anything that they instruct you not to upload. Okay, again, there's violations in place that can be enacted and penalties do apply. Where I say you can password protect whatever you will, and you may encounter that now and then if someone has locked down their My Health Record or a specific document, there is always an emergency access provision where a person is in a state where they're unable to provide you that password. They are in an acute and life-threatening situation, they're unconscious, or something has happened to their capacity to provide you with that password or to give consent, in which case you can use what they call a break glass feature, which allows you to sort of get in the case of emergency. I mention this just to let you know that there are ways and means to actually do this, but I'm expecting that you're probably not going to find yourself in an aged care home in a case where it's life or death for you to access their My Health Record. You will probably not have to use the break glass feature. That's very much an emergency department type feature. Just so you know, though, it exists when you're explaining My Health Record, and know that it might be there, and don't just go ahead and use it lightly. It's every time it's used, it raises a real big red flag with those cybersecurity and everything on the Digital Health Agency. And you need to actually have to really make sure that you've got a justification for having access to something using the break glass feature. So all those acts, the My Health Records Act, the Privacy Act, and all that sort of thing do actually say fines and penalties that do apply for inappropriate use of My Health Record. So the very first step of getting registered for My Health Record is actually to have a security and access policy in place. And so that break glass feature and that sort of thing, look, I've thought about taking this slide out because I would hope that everybody understands the use of sharing clinical information, or rather not sharing. if and where it's appropriate and everything. But if you go, this is an emergency, I really must check my family member, and you're just being nosy, yes, criminal penalties can possibly apply. Most specifically, you can't use it just to check whether there are restricted documents or actually as a training exercise on demonstrating the use of the emergency access function. Okay, look, that will come up as a bit of a pop-up when there is a protected document, and you can choose to proceed pretty easily. It doesn't really require too much training, but you would have to use a bit of discretion and have a justification in place if you want to break glass. What you may find within aged care, though, is representatives, okay, to get around and manage all of those individual nuanced situations of consent and somebody acting on somebody else's behalf. So there's two kinds of representatives that may be at play in aged care that you might need to be aware of. There's what you call a nominated representative, and what we'll discuss next, which is the authorised representative. The nominated representative is chosen, okay? It is chosen by someone with capacity who can give consent and can elect somebody else to get into their My Health record and manage things with them, okay? That might mean that somebody's picking their partner or next of kin or something like that to be able to access their health record to do administrative things, or maybe just to keep them abreast of medication changes, or just make sure they've got access to things that they've made sure go in there, like advanced care planning documents. Okay, a next of kin having access to some record of that, it can be very, very reassuring to them. If some event does happen, there is a loss of capacity to give consent, or something might mean that, you know, their goals of care and such may need to be communicated to the next of kin. They'll have ready access to that, having had that one set up prior. Can really help out with the decision-making sort of process. So look, this is all under control of a resident who has a bit of capacity here. It may need a bit of informed and help to actually enact this, but they can actually set this up to give the extent of sharing, and can actually set up to go, right, this is what this person will have access to. And that involves sending an invite. The actual patient or user sends an invite to their representative, who accepts it through their MyGov account. An authorised representative is used in a situation where someone can't give some sort of consent. And basically, in this case, I mean, the example on the slide here is, you know, a child. Okay, but in this case here, it might be someone with dementia or something, where basically somebody else needs to have complete control. And it's basically an all or nothing thing. You have, as an authorised representative, complete control as if it was your own My Health record. Okay, and because that can't be something where an invite is sent out, this is instead a situation where the authorised representative applies instead. So there's a bit of a process by which that goes on. And that's even to the point where if there was no health record preceding that point, the actual application to become an authorised representative means that one is created. So I'll just flip through a few slides here on exactly what you'll find within My Health record. Now, we've spoken about it generally, and sort of, you know, like how to actually navigate those things. So look, I just want to get your bearings here, in that we do like to talk about the scenario where, you know, the Digital Health Agency loves this bloke named Caleb, uses him for all examples. Caleb does rock up on your doorstep. He's being admitted. He's had a recent fall. We've got multiple chronic conditions here, Parkinson's and early onset dementia, and we've had all of these different fields, GP, pharmacist, RN, and a carer, who are all at play. They all contribute some element of health information. They all need to be able to see that health information. And let's just add the added complication that they've rocked up and it's after hours too. So you're like, hell, I need to work out if any medications are due and all that sort of stuff. What sort of basic stuff can we find out about Caleb right now? So what you might be able to do is actually access the My Health record. And as I've said, there is the clinical information system is probably going to be your primary method of getting in there. That is, hopefully you use a conformant piece of software. Otherwise, there is the National Provider Portal online. But you can actually check the Digital Health Agency maintain a register that's updated each month on which software packages are compatible with My Health Record and which features of the health record they are compatible with. So you can always find that online. Any links that are in these slides, I'll make sure they're available to you at a bit of a later stage. I'll probably get out a copy with my next newsletter. But if there is a link that you're like, oh, I do wish I could check this straight after the presentation, just flick me a bit of an email and I'll send you any content you need, okay? So let's just say, hey, you can just access My Health Record through your software. My Health Record tends to have a bunch of different documents in there, and they get to be consolidated into different, what they call different views. They're a consolidated view which might take different bits of records and give you all the information in a streamlined sort of place. So you've got the medicines view, which is actually going to, I believe it takes information from the Medicare record and the pharmacy dispense record, and potentially even any manually generated pharmacist medicine summaries. And it gives you a bit of information there that is incredibly hard to see now that I've got more going on my screen than I think you guys might have, but I'll just look at it on a different screen. Yeah, it's drawing from the GP's shared health summary as well, but it gives you usually a summarized medication list of everything they do generally take and roughly how long ago they might have had it dispensed. So that can have a few things on there that may not be, oh, geez, I do need to give that tonight. It might have an antibiotic from a couple of months ago and that sort of thing. So discretion applies. This is meant to be accessed by a clinical provider. You've also got flagged there in the color codes up the top. There's a big red square that's got your allergies and adverse reactions too. So it's an excellent place to find those, because sometimes you might find that the GP summary didn't have something or the hospital discharge summary didn't have something, but My Health Record has drawn it from one document amongst three, which actually documents a life-threatening allergy. So it can fill a lot of gaps that may be in some of the records. You've got a medical conditions view. Again, same sort of thing, drawing from specialist documents, hospital documents, GP documents that give you a consolidated list of diagnoses that have been, recorded for an individual person. Immunisation consolidated view, hopefully highly useful to you guys there, where basically pharmacists and nurses always have to, I believe, I don't want to speak for a nurse, I'll definitely speak for a pharmacist, have to record any immunisations that they administer to the Australian Immunisation Register, or AIR. GP, I don't think they really have to, or maybe they didn't have to up until fairly recently. But basically what I'm getting at is sometimes there's some immunisations that have been given that aren't on AIR and may only be included in the GP's record. The immunisation and consolidated view of My Health Record takes anything the GP has in their shared health summary and anything that is in AIR that gets funneled into My Health Record, and it draws both those sources into a single view for you, where you can actually check out everything that's been given lately. And I mean, digital immunisation recording has been pretty good for the last 10 years, I'd say. You're going to have anything that's really relevant that's going to have been given in that time frame there. Childhood immunisations, well, we may not find that something for an age resident is going to be recorded in here, but you're going to have a lot of their currency on influenza, COVID, shingles, RSV vaccines, that sort of thing. Everything will be recorded in here, and you'll have some idea from whether or not they will need a booster. This can be really useful, not just in acute situations, but when you're booking clinics and that sort of thing, looking to see who may be due for something, new admissions, who needs to be caught up. And I believe there are provisions as well for very, very specific non-clinical staff to be doing this. So some senior admins and that sort of thing who may be involved in your vaccination clinic booking may be able to be provided appropriate delegation authorities to go and check certain views like this to help them with assigning residents to a booking of a clinic. Pathology reports and diagnostic imaging as well, both increasingly going into My Health Record. There is a bit of legislation that even just got strengthened in February. They're moving towards what they call a share by default. So bloods, imaging, X-ray, whatnot, you may find that if you don't have it anywhere else, you might find it in My Health Record. And it's actually really great that this is available to the individual as well, just to help strengthen their autonomy in their managing of their own healthcare. Okay, which is really great for consent and such, and understanding. It comes through usually with a lockdown for 7 days after the results are available to give the doc ample opportunity to review the results, check for abnormalities, schedule a callback and go through that in context before someone's alarmed by any abnormal results in their bloods. But it does sort of mean that those cases where everything is normal and the doc never gets back to you about your negative result or something, you can find this information yourself. Discharge summaries are one that is highly, highly, highly valued in aged care and is actually available in My Health Record. I'll put that on, they're available when they're written and when they're uploaded in a timely fashion. But that is basically when they're uploaded to the hospital record. They will be immediately available on My Health Record, which means that it can make it available to you sooner than when they might manually forward something to you. And understandably, that's a pretty rare scenario when they're actually going to forward it manually. So you'll find that, look, I mean, basically, it may not be available straight away, but it might be available pretty soon after you receive somebody. If you just keep taking a look in their discharge summary, there might be available where you get a bit more information about their latest emergency admission or whatever in reasonably prompt sort of time. So My Aged Care, you guys would understand a bit more about these documents, honestly, than I would, but My Aged Care is being integrated into My Health Record too. Care and support plans, you know, agreed goals of support, such like that. I believe also some progress on their assessments and that sort of thing. The more formal documents are becoming available in My Health Record too, so becoming increasingly relevant to aged care. Advanced care planning documents. My Health Record is a home where you might be able to find these ones in here too. Again, one thing that's really quite advantageous to have this and have this shared with relevant family members and such for sort of planning for end of life care and things. So a resident or their authorised representative who can take these administrative actions on their behalf can get these care plans and everything popped into My Health Record, or mostly it's the GP. Okay, so it's coming from the resident or their GP. And so having the GP on board, if you've just recently got access to My Health Record or you're really looking to maximise the information that's in there, working closely with the GP on the documents they can specifically upload is a high priority to make sure it's as informative to all the parties as possible. So the GP maybe uploading these things can be quite helpful as a bit of a pathway. In aged care, it's rare that you're going to have the autonomy to upload this particular document yourself. And unfortunately, things like the Office of Advanced Care Planning and that are not quite doing that as an administrative process at this stage. So it's rare you'll find one in there unless you're taking special measures to make sure this is recorded well in an accessible place. I think I'll actually flick through, and when I see slides down the end, I think it actually refers to the fact that you may be able to put in. Oh, it's on the next page. So goals of care documents, same sort of logic as the advanced care plans. But as I go here, the advanced care document custodian can be recorded in My Health Record. So if you don't have the document in there directly and you don't sort of really have a party on board who can do the uploading, you guys at the very least can probably record in My Health Record where the documents are. even if they're not directly accessible in the record, so that they can be located promptly if and when necessary. The shared health summary is the other reason why it's, if you can get the GP on board with regular uploading to My Health Record for any residents in your care and in your home, the shared health summary is something that's actually the most useful, in that it actually has all the GP's summary information of medications, diagnoses, history, and immunisations. It doesn't go in automatically imported from their software, but it is a reasonably simple process for them to do manually. They just need to be practiced in doing it as a matter of habit, but it can be generated from their software and uploaded with relatively few clicks of a button. So if you're working with the GP and expressing that, hey, you do like a shared health summary periodically uploaded for an aged resident, try and do that and you should start to see that go in. But they're very rarely put in as a matter of default practice by the GPs. Event summaries, kind of like a discharge summary from specialists and other sort of care scenarios. So they're a useful piece of documentation you may see in there too. And moving on, you've got a few residential care documents that are coming to My Health Record, are not in common implementation right now. But if I flick through to here, you've got a bit of an explanation about what's going to be in there. You've got your transfer reason, you have your care summary document, and you have a space and an upload feature of the medication, the transfer medication chart, basically a location where it can be documented, and your age software may actually produce a template that can be uploaded. But this is sort of where you would find administrations of medications and such that were given during transfer, which is often really poorly documented. So between aged care homes or between hospital and an aged care home, basically this is all sort of the contents of that sort of yellow envelope type situation, but it's not going to get lost, and it's going to be accessible promptly. You're not finding that it's just sort of been taken away to sit on somebody's desk. And so I'll just sort of flip slowly onto, most of these last slides are something that I've put in as practical assistance to sort of get things registered. So I've just popped through a whole bunch of things where we've just gone about how great My Health Record is when it's used properly and all the information is there, and why don't we all get on board. I hope to really break down, because if you're sort of here, you may have found that, look, there's been difficulties in many homes getting registered before. It's been a slow moving process. It may have been stymied. You know, there might be something that's not quite been finished off, and, you know, it just kind of got dropped halfway through. Or you may have found that you got registered somewhere in the past and then things kind of dropped off in usage, and a lot of individuals aren't registered to access it right now in a practical sense. But if you are thinking about your registration, I've broken it down into just a few little steps here. The first thing, before you even take any action, is they want a security and access policy written. The next is you actually got to do the registration, which predominantly occurs through PRODA. Then when you're just about ready to go, you make sure your staff are trained and current, you get them their access, and you just get cracking. There are ongoing participation obligations, which is more or less just like a refresher training each year and making sure the organisation does train its new staff as part of its inductions. So to make those steps as easy as possible, security and access policy, I think, is the first stepping stone that really gets people. It really gets especially the large national banners. They start thinking about, oh, geez, it's got to be this big, hard thing that's got to cover 40 facilities nationally or something like that. It's the thing that they tend to really find that the upstairs clinical governance really get hung up on. I want everybody to know that it's not meant to be hard. The Digital Health Agency does give you a lot of instruction on doing it. They give you a template that is full of, put your name here. Yeah. Put this drop-down menu through, select your yes and no's. This applies to me and this does not.
My Health Record, it's not really that.
All right. Wasn't sure if we had a question there from Bien. She's dropped out. But yeah, there is a template. Okay, and we can make sure that you've got access to that. If you're a standalone aged care home, it is really stock standard. You just yes, no, fill in your name all the way through. If you're a larger structure, there are some unique things that may apply to you. So there is actually a checklist that I've got small there. You can't see it, it's purely illustrative, but basically there's a checklist that you can go through after you've done your template and make sure you actually meet all the legal requirements as they apply to you. So if you've got some curly situations, you just tick, 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 tick as you read through your own policy and just make sure that after you've made your little modifications, it all still fits the legal bill. The next part is your actual registration process. Okay, largely, as I said, that actually occurs in PRODA, and that is, I mean, most homes are halfway through that. If you use AIR or something, then immunisation record or other PRODA services, you probably also, everybody's probably registered for PRODA. You're probably linked to the health professional online service, and the rest is just sort of my health record specific steps. There are steps there. You got to go through it. You get allocated a series of numbers. You get your organisation registered in PRODA, and then you get all your clinical staff who are going to be attached to the organisation registered and linked within PRODA. It's sort of a bit of a complicated step. Again, there is a checklist for that one there. You can't really see it too well on the actual slide, but you've got a sheet of paper there, and if you just looked mostly just to see all the blue, those are all just hyperlinks. It's a step-by-step, work your way down the page, tick, tick, tick. I do this, I've done that in PRODA, I've sorted this, I've applied for that. And those blue links actually take you to further instructions that detail each step if you're finding one is causing you any particular difficulty. There is a really good training module that I can get you guys the link for. It is actually linked in these slides when you get those materials if you just click that left-hand picture, but it actually goes through again as a training kind of module that takes about a half hour to work through, that the person who's actually in charge of registering your site can work their way through in a step-by-step module with 9 steps to actually get registered, and well, half of those steps being optional based on your particular organizational structure. So that's a really good one. Reach out to me for any particular materials if you're just finding yourself confused by any of the steps. And then the last bit was just your ongoing obligations to stay current and trained. There's heaps of online modules, links and links and links. The Digital Health Agency just has all of these ones here that you can just, at a minimum, mostly, it's just making sure your staff are inducted to do one of these modules, and then keeping up an regular interval of making sure refresher stuff does happen so people are aware of their obligations. There's no fixed, has to happen every 12 months or anything, but it just needs to be part of your policies that you've got a strategy in place to make sure your staff are aware. And we're on to finally the biggest reason I did this presentation here today, and that's mostly that there is bespoke support for your organisation. You can actually reach out to the Digital Health Agency at this email address in the centre here, and you can get yourself allocated a bit of like a caseworker who will actually step you through this is what's going on in your particular scenario. Let me help you apply for the next step. They take a little while to get back to you, so I'd really like to delineate some responsibilities. If you've got a little question you'd like answered promptly, feel free, make use of me. If you've got like a really curly kind of thing, you want to get it straight from the horse's mouth from the Digital Health Agency, these guys are the way to go. They may just take a few days to sort of get back to your queries. Okay, but feel free, if you are looking for assistance in getting registered, these guys are the specialty team in aged care home registration. The email address is sort of right there for you on the screen. And I'll make sure that goes out as well to highlight that, just newsletters and everything. It's gone out before. They are doing drop-in sessions. Okay, just to make sure you're feeling loved. Okay, there is a link there to get registered. I will probably send that one out fairly promptly just as a summary on this session to anyone who did participate. The next session is coming up on the 31st of March. They're actually going to show you a bit of a functionality of viewing my health record within a piece of software, and they've got basically a bit of aged care insight coming from somebody who has worked with my health record in practice. So they happen every month, and they make sure they're an interactive Q&A type thing. There's a panel there, and you can really talk about the nitty-gritty of using My Health Record in aged care.